South Africa has recorded its first case of Mpox since August of 2022. Health authorities say a 35-year-old man living in Gauteng tested positive on the 9th of May, so just earlier this month. The patient apparently has no travel history to countries affected by the outbreak. Let's unpack the story further with Dr. Jacqueline Veyer. She's the head of the Centre for Emerging Zoonotic and Parasitic Diseases. Dr. Veyer, it's good to talk to you. Thanks very much for coming on. What are you making of this case, given that there's no travel history to countries that are affected by this outbreak?
So, yes, this obviously implies that the patient contracted the disease in South Africa, but we also had the same situation with one of the previous cases that were recorded, or that was recorded in 2022. So investigations are ongoing to try and determine if there are any, or where the linked case or cases are, and how many of those there are. So I think at the moment, not necessarily a great cause of concern. As in the previous case, there was a direct link to a person that did travel to a country that was recording Mpox at that stage. So I think let's let the investigations run its course before we make a conclusion on that.
Sure. And perhaps just a moment to backtrack and tell our viewers just exactly what Mpox is and how it can be contracted.
Right, so Mpox is a disease that we've known for a very long time, but in a very different way. So it's a disease that's been recorded from a number of African countries where it's transmitted in a zoonotic fashion. So that means from animals to people, and human-to-human transmission has been very limited. Now, it's actually quite a complicated story, so I'll try to make it short for this purpose. Smallpox vaccination actually protected against Mpox vaccination or Mpox infection as well. So I think the emergence of Mpox has definitely been due to the waning immunity. People are not vaccinated for smallpox since 1980. And as we have new individuals entering the population, obviously they're not protected in that way. So we're seeing this disease emerge because of that waning immunity in a susceptible population. And we're seeing it in a way that we haven't known it before. So in 2022, we saw massive emergence of Mpox in a multi-country outbreak, recorded cases in more than 100 countries, almost 100,000 cases recorded since. And in 2022, when this multi-country outbreak was at its peak, South Africa detected and reported 5 cases. And we still see ongoing transmission within the context of the multi-country outbreak. About 20 countries still reporting cases actively. So while that risk remains, obviously we can also expect to have cases in South Africa, and that is what we have to do.
Right. And Dr. Veyer, how does it present? What are the warning signs that I may have Mpox?
So the most prominent feature of Mpox is the skin rash or the lesions. And you'll find pictures of that all over the internet, so you can have a look. It's quite difficult to explain, but it's got a very prominent and specific look. So it's really difficult to mistake it for anything else. And prior to the rash, you would have what I would call, a flu-like period of not more than a week. So it's really the skin rash. By far, most cases present very mildly with few lesions, but we do see more serious cases, especially in people that are struggling with other health issues, particularly those that are struggling with immunosuppression for whatever reason.
I mean, could it be a case where I am feeling, I'm experiencing flu-like symptoms, but I don't have the lesions, but indeed it is Mpox? Is that possible?
So the lesions start appearing within a week after the onset of illness. So you'll very quickly know if it's Mpox, and the disease is only transmissible at the stage where the lesions start to appear. The lesions can take up to a month to resolve. So that in itself is a bit disconcerting. But as I mentioned, this is a disease that's mostly managed without any specific medical intervention. few cases do require hospitalization, but it's disconcerting more than anything else. So it's quite difficult once the rash appears to confuse it with anything else.
Okay. So as you said, the investigations into this case, the 35-year-old man living in Gauteng, testing positive just a few days ago on the 9th of May, no travel history, no countries affected by the outbreak. So what are your investigations trying to ascertain now, aside from, of course, how he got infected?
So the investigators are working with the patient to try and identify contacts within a certain period of time. So these infections are subject to a specific incubation period. So we've got an idea of when this person started getting ill and when they would have been likely exposed to the disease. So it's a process of working with the patient and trying to identify individuals that they have been in contact with and the type of contact that would be required for transmission of Mpox within a certain period of time, and then following up with those individuals as well. So in essence, contact tracing. So so it's a process. Obviously, this patient also requires time to heal and time to recover. So the process does take a little bit of time.
And what is there a specific kind of contact that requires Mpox to be transmitted from one person to another?
So the monkeypox virus is transmitted through very close contact. So we would be typically looking at people that share a household, family and friends or roommates, but also sexual partners. Sexual transmission.
Right. So for anyone who might be experiencing the symptoms that you're describing, Dr. Veja, what should they do outside of obviously seeking the necessary help? How do you report or get a confirmation that indeed you do have Mpox?
So there's laboratory testing that we can do. PCR testing is mostly done. It's widely available in South Africa. So your general practitioner or the physician that you are consulting can request a test if there is a concern about monkeypox. And the tests are really sensitive and robust. So you can also, so this is the way that you can determine whether you have monkeypox or not. If it's a more complicated case, as I've mentioned, in most instances, patients really don't need any specific medical management. In few cases, they might require some support and even hospitalization. So we want to make sure that those patients do get the support they need.
Absolutely. Dr. Jacqueline Veja, let me thank you for your time this afternoon. Thanks for clarifying some of those questions around Mpox. She is the head of the Centre for Emerging Zoonotic and Parasitic Diseases. So one person living in Gauteng testing positive for Mpox, but not quite at the stage now where there's any real cause for concern. But if you do have any of the symptoms being described there, do visit your GP.